Good morning, everyone, and thank you so much for joining us for Spirit, the stimulating program initiative for retirees that inspires thought. I'm Judy Steinig, Director of Community Programs for the Orthodox Union, and it's my honor to coordinate and host this program. The OU created Spirit several years ago as an on-site program, and now we're happy to present it as an online program for baby boomers, active retirees, not yet retirees, empty nesters, sandwich generation parents, and seniors. Everybody who looks for opportunities for educational, intellectual, and spiritual growth. Since we all continue to shelter in because of the pandemic, Spirit has become the perfect way for all of us to engage in a virtual setting. Today's program is our second session in conjunction with New York Presbyterian Hospital of Queens, and we so appreciate all their help in making these arrangements. Today, we will be discussing heart health with Dr. Sijun Kim, DO. Dr. Kim is a board-certified cardiologist at New York Presbyterian Hospital of Queens, and it is my honor and privilege to turn the program over to him. Thank you, everyone, for joining us, and I know that you'll gain a lot from this program.
Good morning, everyone. My name is Sijun Kim. It is an honor and pleasure to be here speaking to you today about cardiovascular disease and prevention. Over the next 40 minutes or so, I will give an overview of the different types of heart disease, how we diagnose it, how we can treat it, and how we can prevent it. I want to start by first talking about the United States life expectancy at birth. Since the 1960s, the average male and female can expect to live anywhere between the mid to late 70s. And if you look at the trend for age-adjusted mortality rate per 100,000 population, you can see that since 1999 to 2017, heart disease has actually been downtrending. So why am I giving this talk? I'm giving this talk because heart disease is still the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. In fact, every 37 seconds, one person dies here in the US from cardiovascular disease. About 647,000 Americans die each year due to heart disease, and that's about 1 in every 4 deaths. And it's costing the United States about $219 billion each year related to healthcare services, medicine, and loss of productivity due to death. When we look at the top 10 leading causes of death in the US for both male and female, it is unanimous. Heart disease is the leading cause of death, followed by cancer. When I talk about heart disease, I'm specifically talking about coronary artery disease because it is the most common type of heart disease and it kills over 350,000 people in 2017. About 18.2 million adults aged 20 and older have heart disease. That's 6.7%. In fact, 2 in 10 deaths from heart disease happens in adults less than 65 years of age. In the US, every 40 seconds, someone has a heart attack, and about 800,000 Americans have a heart attack each year. So what exactly is coronary heart disease or coronary artery disease? It is a process in which there is a progressive narrowing or blocking of the coronary arteries, usually caused by a pathological process called atherosclerosis. Simply defined, atherosclerosis is basically hardening, calcification, and clogging of the heart arteries. And it is due to the buildup of cholesterol and fatty deposits. And we sometimes call this plaque, which occurs along the inner wall of the arteries. Over time, if your risk factors for heart disease are not well controlled, it can start to encroach in the inner aspect of the artery and begin to restrict blood flow to the heart muscles, and patients can develop significant symptoms. This is an anatomy of the heart. As you can see on the left side of the screen, it is an anterior view of the heart. And the heart has two major coronary arteries, the right coronary artery and the left coronary artery. The left coronary artery then divides into what we call the left anterior descending artery and the left circumflex artery. If you look on the right, you can see the progression of atherosclerosis. Initially, you begin to develop the plaque in the inner lining of the artery. And over time, the plaque grows and it begins to damage the artery itself. And as it grows, it becomes prone to rupturing. And when it ruptures, there's a blood clot that can form right on top of it. And sometimes it can significantly occlude the flow of blood to the heart muscles. And that's when you have a heart attack. How can we diagnose heart disease when you see a heart doctor? Well, we can do a study called an electrocardiogram. It's short for EKG, or you might have heard ECG. And it basically assesses the electrical activity in your heart. It is done by performing some leads on the front of your chest. And we basically get an electrical reading of the heart. And we can tell based on this whether you're having an acute heart attack or if you have any signs of damage to your heart muscles. If your doctor is expecting that you may be suffering from significant heart disease, there are several tests we can perform to assess for that. One is an exercise treadmill stress test. We simply do an ongoing live EKG and monitor your blood pressure and heart rate while we have you slowly run on the treadmill. The study is typically done so that every 3 minutes, the speed of the treadmill gets a little bit faster and a little bit steeper. And our goal is to see how well you do. And then we can match that up against the population to see how you did in comparison. And if you have significant blockages that is implied by your stress test, then further testing can be recommended. But not everyone can comfortably or safely exercise on the treadmill. In those cases, we can perform a chemical stress test. We call that a nuclear stress test, where it involves injecting some medications into your IV, and it stimulates your heart. It stresses your heart. And then we can take some pictures using a camera to see if you have significant heart disease. If your doctor tells you that one of these tests is abnormal, or your doctor thinks you're having a heart attack, or if your story and your history is so concerning, he or she might refer you to a procedure called a cardiac catheterization. Another word for it is a coronary angiogram. And this is typically done through your groin or your wrist. And they introduce a small catheter all the way up to your heart, and they inject some dye directly into your heart artery so we can see visually if there is any evidence of blockages. This is done not under general anesthesia. It is not done while you are intubated. You are actually awake this entire time. We give you some medications to give a calming effect so you're relaxed, and it's done through a small incision in your groin or your wrist. If you're deemed to have a significant blockage in your heart artery and you're having significant symptoms, we can then employ what we call a stent. It is done through a small catheter, and we can use a balloon to crush the plaque and then deploy a stent, as you can see in the diagram. This is a patient of mine from last year. She was 70 years old. She had hypertension. She had a high cholesterol and diabetes. She complained of progressive chest pain that was in the center of her chest. Because of the concerning story, we took her to the cardiac catheterization lab and we injected some dye into her heart artery. And you can see on the left that there is an obstruction of flow in the mid-right coronary artery. And you can see that the vessel tapers and becomes very, very narrowed. And this is probably why she was having her symptoms. So we were able to put a balloon, open that up and put a stent. And now you can see on the right how nice it looks. Her symptoms of chest pain, chest pressure, shortness of breath, all resolved following this procedure. So what exactly are symptoms of heart disease? As you all know, you can have chest pain. Some people might report chest pressure or chest tightness. Some patients might state they feel like they have something heavy on their chest or someone is pushing on their chest. Some patients may feel just shortness of breath that is unusual to what they're normally expecting. Some patients might not have chest pain at all, or even shortness of breath. They might have sweats, nausea, vomiting, and some patients might have excessive fatigue. What's concerning is that in some patients, especially if you have a long-standing history of poorly controlled diabetes, it can affect the nerves innervating your heart, and some patients might not have any symptoms at all. Especially in the elderly population, these patients tend to have symptoms that are very atypical, that are not very common. So it's important that you see your doctor if you notice any symptoms that is not normal to you or that you've come to expect from your own body. Heart disease or serious coronary artery disease can lead to congestive heart failure. So what is heart failure? What do we mean when I say heart failure? It's basically a state in which the heart cannot meet the demand of the body. The heart cannot pump enough blood and oxygen to support other organs in your body. And the two leading causes of heart failure is high blood pressure that is long-standing and uncontrolled, and coronary artery disease. In fact, about 6.5 million adults in the US have heart failure, and heart failure was a contributing cause of death in 1 in 8 deaths in 2017. In order for us to understand what exactly is heart failure and what does it look like from a patient perspective, I think it requires some understanding of just basic cardiac anatomy. This is an image depicting the heart in the center of your chest. It is right underneath your sternum, and it is lodged right between the two lungs, above the diaphragm. If we look at just the heart, again, you can see the two main coronary arteries. You have the right coronary artery, and you have the left coronary artery that then divides into the left anterior descending artery that comes in front of your heart down to the apex, and you have one going across laterally called the left circumflex. The heart, in simplistic terms, is made up of 4 major chambers. But in order for to understand this easily, it might just be simple. It might be better to understand it from a right heart, from a left heart. The right heart composed of the right atrium and the right ventricle. And then there is the left atrium and the left ventricle. When we look at the inside of the heart, the blood that returns from our body goes into the right atrium. It then crosses a valve and empties into the right ventricle. The right side of your heart is important because it pumps blood into your lungs so that the blood can get oxygenated. Once the blood is oxygenated, it can then return to the left side of your heart, into the left atrium. From the left atrium, it crosses a valve and enters into the left ventricle, which is the thickest part of your heart. And it's important because it squeezes blood out to the rest of your body, including your brain, your heart artery, your kidneys, and your liver. So to sum it up, the right heart receives blood from your entire body. It then pumps blood into the lungs, depicted at the top, where it gets oxygenated, and then the oxygenated blood returns to the left side of your heart, and then pumps blood to the rest of your body that is full of oxygen and nutrients. So what happens when you're in heart failure? Well, one thing you could begin to notice is shortness of breath. And why is that? It's because when the left heart begins to fail, the pressure inside the left heart begins to go up. And when it goes up, that pressure is transmitted all the way up into the lungs, and it can cause fluid to accumulate in your lungs. And so some patients might notice, I feel more short of breath than usual. I'm normally able to walk about 4 blocks, but I can't even walk 1 block because I feel so short of breath. They might have trouble laying down flat on their back, because when you lay down flat on the back, it promotes blood returning to the right side of your heart, and that can cause the pressures inside your lungs to even go higher. So if uncontrolled, if heart failure progresses, the high pressure in the lung because of the failing left heart causes high pressure in the right side of our heart. And when that happens over time, the fluid can then accumulate in the legs and in your abdomen. Some patients might feel some bloating. Some patients might notice that their legs look more swollen, and it doesn't simply get better when they raise their legs. They may notice that they could push a finger on it and it'll leave an indentation. We call this leg edema. Some patients might notice involuntary weight gain. It has nothing to do with their diet, but they're noticing they're gaining 3 pounds, 5 pounds, and over a month, 10 pounds, and it's completely involuntary. Some patients might notice an associated shortness of breath. They can't walk as far as they used to. They might notice that their legs are looking more swollen than usual. These are all signs of congestive heart failure. And as I mentioned before, the two leading causes is hypertension or high blood pressure or coronary heart disease. So what can we do when your doctor is suspecting heart failure? We can do a non-invasive test called an echocardiogram. It basically uses an ultrasound wave to look at your heart. It is not painful, it is rather quick, and it gives us an idea of what your heart looks like. Here are two patients. On the left side, you can see a normal heart. This chamber that you're seeing here is the left ventricle. Remember, the left ventricle is important in pumping blood to the rest of your body. In this example, the left ventricle is squeezing very, very well. You can see that it looks vigorous, it looks strong, it looks great. But compare it to the one on the right side. This heart looks a little bit bigger, and you can see compared to this heart that is significantly weaker. This patient had long-standing history of poorly controlled hypertension and also has significant heart disease. So what are the risk factors for coronary artery disease or coronary heart disease? As I alluded to earlier, hypertension or high blood pressure, hyperlipidemia or high cholesterol, smoking, diabetes, obesity, sedentary lifestyle, and genetic predisposition are all important risk factors for coronary artery disease. When you see a heart doctor or a primary care physician, oftentimes you will be assessed for your risk for heart disease. And the way we can minimize your risk is making sure your blood pressure is well controlled, your cholesterol is well controlled, helping you quit smoking if you smoke, making sure your diabetes is well controlled, and making sure we're helping you to exercise and lose weight. So what is hypertension? High blood pressure is called hypertension. And again, if untreated, can lead to significant risk for heart disease, which includes heart attack, stroke, kidney failure. And some of the risk factors of hypertension are very similar to risk factors for coronary heart disease. As we age, our arteries become more calcified, a little bit more thick, and it can cause our blood pressure to slowly increase. Being obese, having a lot of weight, it increases the metabolic demand and it can cause hypertension. Family history certainly plays a role. Maintaining a diet high in salt can cause high blood pressure. And excessive alcohol consumption can also cause hypertension, as well as smoking. Why smoking? Because smoking causes the arteries in your heart to constrict. And this includes coronary arteries and physical inactivity. But there are other things that can cause hypertension too, such as ibuprofen. If you have hypertension and you're required to take medication, ibuprofen can cause your blood pressure to increase. Steroids can also cause your blood pressure to increase, and certain antidepressants can also cause blood pressures to increase, as well as some of the over-the-counter decongestants. So this is a picture depicting health threats from hypertension. As I mentioned earlier, poorly controlled hypertension can lead to heart attack. It can lead to a stroke. It can cause vision loss. it can cause kidney failure, it can cause your heart muscles to get weak, and it can cause sexual dysfunction. If you look at this all together, there is a very common theme. High blood pressure, inactivity, smoking, diabetes, and high cholesterol can cause stroke and heart failure independent of having hypertension. So it's important that your blood pressure is well controlled because it is a common denominator amongst all of these problems. And this is why a lot of your primary care physician doctors, your cardiologists, emphasizes that your blood pressure is well controlled. So what is hypertension? How is it defined? The American College of Cardiology and the American Heart Association came out with a consensus guideline in terms of what is hypertension. And it's easily defined as a blood pressure of 130 or 130 over 80. So either the first number, the systolic blood pressure, more than 130, or the diastolic blood pressure, which is the second number of 80 or more. This is considered hypertension. So what is normal blood pressure? Well, normal blood pressure is a pressure of less than 120 systolic and less than 80 diastolic, or the second number. Anything in between those two numbers is considered pre-hypertension. If your blood pressure is excessively elevated, such as if it's over 140 systolic or over 90 diastolic, your doctors will likely prescribe you a medication to better control your blood pressure. But keep in mind that not everyone, especially in the elderly population, can tolerate a blood pressure of less than 120 over 80, especially if they had long-standing history of hypertension. And so it's reasonable to have a little bit of a loose requirement when it comes to this, because ultimately we want you feeling well and we don't want you feeling dizzy or lightheaded because of excessive blood pressure control. So a good target blood pressure is different for each person. So it's important that you speak to your doctor to find out what's a good goal for you. How can we treat hypertension without taking medications? Obviously, a lot of us don't like to take medications, but thankfully there are ways we can treat hypertension without medication if that's possible. One, we can limit the salt intake. Per day, if you can limit your salt intake to less than 1,500 milligrams per day, or even if you could just reduce it to about 1,000 milligrams per day, you can expect a blood pressure decrease of about 5 points in your systolic number. That's 5 points. So if your blood pressure is 135 with strict dietary salt restriction, you can expect it to come down to about 130 on average. 2, weight loss. I mentioned earlier, having significant weight is a risk factor for hypertension. So weight loss can also help. In fact, if you lose about 1 kilogram, that will correlate to about 1 point drop in your blood pressure. So if you were to lose about 5 kilograms, you can expect to drop about 5 points in your systolic blood pressure, maybe even more. A healthy heart diet, we call it DASH diet. And basically this is a diet in which you consume a diet high in vegetables, fruit, low-fat dairy product, whole grains, poultry, and fish. You really want to avoid sweets, sugar-sweetened beverages, and red meat. And look at how much your blood pressure can come down simply with a heart-healthy diet, almost 11 points. So if your blood pressure was 140 and you follow a strict heart-healthy DASH diet, you can expect it to come down almost 10 points, quite significant. Number 4, aerobic exercise. We recommend about 90 to 150 minutes per week of exercise, moderate intensity. This could involve brisk walking, jogging, dancing, bicycle, and swimming. And with exercise, you can expect to drop about 6 points in your blood pressure. Obviously, if you're not very active, I don't want you to go out and start exercising. So you should always check in with your doctors to make sure what is a good limit for you so that you don't hurt yourself. And finally, moderation in alcohol intake. For men, we recommend drinking two or less drinks daily. For women, one or less drinks daily. And what is considered one standard drink? That's about 14 grams of pure alcohol. So about a 12-ounce regular beer with a 5% alcohol content, or a 5 ounce of wine, which has approximately 12% alcohol content. If you implement these 5 changes to treat your hypertension, your blood pressure will come down. So how can I now improve my cardiovascular risk? As I mentioned earlier, nutrition and diet is very, very, very important. And I really want to emphasize the importance of consuming more vegetables, fruits, legumes, nuts, whole grains, and fish. You really want to replace saturated fat with dietary unsaturated fat. And you really want to minimize the intake of processed meats, refined carbohydrates, and sweetened beverages. I mentioned, again, physical activity and exercise. The American College of Cardiology and the American Heart Association recommends that all adults should engage in at least 150 minutes per week of accumulated moderate intensity or 75 minutes per week of vigorous intensity aerobic activity. So what do I mean by moderate intensity and vigorous intensity? If you look to the right, moderate would be brisk walking at about 2 miles per hour, or biking about 5 miles per hour, ballroom dancing, active yoga, or recreational swimming. Vigorous is considered running, jogging, biking at a speed of more than 10 miles per hour, single tennis, or swimming laps. But before you start on a moderate or vigorous physical activity, as I mentioned before, it's important that you check in with your doctors to make sure you're safe to participate in activities like this, especially if your body's not used to functioning at this high level. As I mentioned before, we really want to emphasize decreasing sedentary behaviors. And we really want to minimize the intake of processed meats, refined carbohydrates, and again, sweetened beverages. There's a common theme here I hope that we're all beginning to understand. To improve our cardiovascular risk, we need to make sure diabetes is well controlled. As you all know, diabetes is a condition in which your body is unable to process the sugar in your blood, and it can lead to excess blood sugar levels. And the reason why this is bad is because it can cause damage and inflammation in your heart arteries. And so it promotes that process of plaque formation and accelerates the process of atherosclerosis. As I mentioned earlier, smoking is also very, very important because smoking can not only lead to cancer, hypertension, but it also promotes and accelerates plaque formation and can lead to significant heart disease. And not just heart disease, but also affect the entire artery in your body. You can develop diseases in your legs so that you might find yourself walking only a block and your leg begins to cramp up because the circulation in your leg is not very good. Or it can also cause disease in the arteries in your brain and increase your risk for stroke. In order for us to prevent the formation of heart disease, one of the most easily modifiable risk factors is controlling your cholesterol. It's important that you talk to your doctor about what is a good cholesterol level for you. In the American College of Cardiology and the American Heart Association recommends that you take a cholesterol lowering medication called a statin if you have diabetes, regardless if your cholesterol is high or low. The reason why I say that is because cholesterol lowering medications like statin have been proven through vigorous research studies to not only lower cholesterol, but also prevent pre-existing plaques from rupturing and causing a heart attack and stroke. In fact, we know through vigorous research that the lower your bad cholesterol, the LDL, the better your risk profile. So ask your doctor if you should be on a cholesterol lowering medications. And if you have diabetes, you should certainly be on a cholesterol lowering medication. As I mentioned earlier, blood pressure is very, very important. It is a common denominator in all of these problems. So it's important that you try to optimize this through the 5 recommendations I gave you earlier. And keep in mind that short sleep duration, as defined as less than 6 hours per night, or poor quality sleep, has also been associated with high blood pressure. Sleep apnea has also been associated with high blood pressure. And obviously, stress management. So what affects cholesterol levels? Again, there's a very common theme here. Your diet, your weight, your physical inactivity, your age, gender, and your genetic predisposition all affects your cholesterol level and is a major risk factor for the development of heart disease, which is why we really advocate making sure your cholesterol is well controlled when you see your primary care physicians or your heart doctor. I mentioned to you all again that smoking is one of the leading causes of heart disease, stroke, and hypertension, and is a major preventable risk factor. So it's important that if you smoke, that you talk to your doctor about ways that they can help you to quit smoking. There's patches, there's nicotine replacement therapies, and there's medications that can help curb the craving for smoking. Smoking, as I mentioned earlier, can increase your bad cholesterol, decrease your good cholesterol, increase your blood pressure, increase the inflammation in your heart artery, increase your risk for cancer, and ultimately, all of this combined can contribute to the formation of atherosclerosis or plaque formation, not just in your heart artery, but your kidneys, your neck, your heart, as well as your brain. There are many, many available treatment options to help you quit smoking. Make sure you talk to your doctor about these options so that we can help you to modify this leading preventable risk factor. This slide is meant to be a summary of all the ways we can decrease our risk for heart disease. I mentioned again, smoking, exercise, making sure you maintain a heart-healthy diet, making sure your blood pressure is well controlled, and making sure your diabetes is well controlled. In summary, heart disease, again, is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. Although we've made significant progress over the past few years, we still have a lot of work to do. And it's important that everyone recognizes what are the risk factors of heart disease so that we can do our best to treat it and prevent you from having a heart attack and stroke. I mentioned that in congestive heart failure, the leading causes are hypertension and coronary artery disease. And the symptoms of coronary artery disease can be very vague, especially in patients with long-standing history of diabetes who may not have any symptoms at all, or in the elderly population, particularly females. You can have non-specific symptoms, like I mentioned, just excessive fatigue, feeling nauseous, feeling unwell. So make sure you listen to your body so that you could be alert for these symptoms. And if you feel like you're at an increased risk for heart disease, make sure you talk to your primary care doctor and see whether or not you need to see a cardiologist. As I mentioned before, we talked about the anatomy of the heart and how the heart works, how the heart pumps blood. I mentioned that there's a right side of the heart and there's a left side of the heart. And the right side of the heart pumps blood to our lungs, where it gets oxygenated and then returns to the left side of the heart, where it can then pump to the rest of our body. If the left heart begins to fail, you can develop shortness of breath. You might have trouble sleeping on your back because you can't lay flat due to shortness of breath. You might find yourself inadvertently using more and more pillows to keep your head up to make yourself comfortable. You might notice some abdominal bloating. You might notice some swelling in your legs. And you might notice, or someone might notice, that you might be gaining weight despite no changes in your diet. And most importantly, Understanding and identifying what the risk factor for heart disease is important for prevention. And as I mentioned, they are hypertension, hyperlipidemia or high cholesterol, diabetes, smoking, family history, obesity, and sedentary lifestyle. And you might recognize that out of all of these risk factors, you can control most of them, except for family history. Thank you very much.
Thank you so much, Dr. Kim. A couple of questions have come in, and I'm going to mention that if anybody else has a question, you can put it in the chat now. Just please make your questions on a more general basis. As Dr. Kim said, if you have any personal situations, you should obviously speak to your own personal doctor. All of our sessions are meant just as information, not as anything specific. You must talk to your own doctor. Okay, so the first question is, does 6 hours sleep have to be contiguous or in a row? Or if you have 3 hours and 3 hours or some permutation, would that still be beneficial?
Yeah, that's a great question. When we have lack of sleep, when we have poor quality of sleep, we tend to sleep at a short spurts. And so this would fall in the realm of increasing your risk for heart disease. So if possible, it is helpful if you can sleep for more than 6 hours. But that said, if you don't do that, that doesn't, although it increases your risk for hypertension, it shouldn't have a significant detrimental effect on your health. But just keep in mind that it can cause your blood pressure to go up. So it's important to be vigilant and be on medications if you have excessively high blood pressure.
Okay. Next question. How can a CAT scan on the heart help to find out about the arteries?
That's a great question. So that's something I didn't discuss today. So there is a study called cardiac CT. And basically it is a CAT scan of your heart. Just like you get a chest x-ray or a CAT scan of your chest, we can now do a CAT scan of your heart. And it is a high definition study so that we can have a direct visualization of your heart arteries. So we can see directly if you have any plaque, whether small, moderate, or severe. And we can see if you have any calcium in your heart artery, which could be which basically means that you have heart disease. So this is a great study and a great test. Obviously when we perform the study, we have to use contrast. So if your doctor is going to order the study, he or she will make sure your kidney functions are looking good and that your heart rate can be low enough so that we can get good images for the study.
Okay. If you have called for an ambulance thinking you are having a heart attack, God forbid, should you stay seated rather than lie down? As you said, lying down makes pain from pumping blood to the lungs. So what does somebody do?
So if you're having sudden onset of chest pain or you're having symptoms that is unusual to you and you're worried that you might be having a heart attack, you need to call 911. And you need to stay where you are. You need to call for help. You should sit down because we don't want you to fall if you were to go into a dangerous heart rhythm, because there's a risk of passing out if you're having a significant heart attack. So my recommendation is for you to call 911, not your primary care doctor, but 911. Tell them you're having chest pain. And a lot of EMS providers, once they hear that you're having chest pain, they will treat it like you're having an active heart attack. And because if you don't get medical attention as soon as possible, it can cause permanent damage to your heart muscle, they will come to you as soon as possible. But in that meantime, you need to sit down, you need to be at rest, and you need to make sure that you don't fall and you don't hurt yourself while waiting.
Okay. I think the question though was, is it sitting or lying down? Which is preferable?
So I mentioned about lying earlier. Some patients with heart failure can have high pressures in their heart. And so when they lay down, because it promotes blood to return to your heart, it can cause shortness of breath. So if you're having a heart attack, it's okay to lie down. It's okay to lie down, especially if you can tolerate it.
Okay. Okay, and I want to recommend to everybody, if you have Hatzalah in your neighborhood, they will probably get to you faster than 911. So everybody should always have the Hatzalah number everywhere in your house where you can find it easily. Okay, next question. How can one increase the HDL?
That's a great question. So exercise. Exercise has been one proven way to improve your good cholesterol. So if your HDL is low, and you think you're not as active as you can be, then start moving, start exercising, and it could help improve your good cholesterol or your HDL. There are medications out there that has been shown to improve your HDL level. However, this has not translated into improved clinical outcomes. So we generally do not prescribe medications that have traditionally been prescribed to improve your HDL levels. So the best answer here for that is just exercise.
Okay, next question. Is red wine supposed to be helping the smooth flow of blood?
Yeah, I think a glass of wine a day, it's great. I don't think that would have any major harmful effects unless you have severe heart failure. Then you should talk to your doctor about whether or not you should be drinking wine.
Okay, which I think, talk to your doctor before you make any changes. That's the general rule. Okay, what is a DASH diet?
So as I mentioned before, DASH stands for Dietary Approaches to Stop Hypertension. And it's basically a diet where we promote people from taking increasing consumption of fruits, vegetable, grains, legumes, trying to stay away from saturated fat. And so it's just a basically all-encompass term for a heart-healthy diet that I mentioned in my presentation.
Okay. Can you see more with an MRI?
You absolutely can. So I showed you an image of the heart with an ultrasound of your heart, ultrasound. It is a very quick and non-invasive way to look at your heart directly. You could kind of think of a cardiac MRI as like an echo, but on steroid. We could get high definition images. Is it a necessary for heart screening? Absolutely not. A cardiac MRI is an advanced imaging modality that is reserved in certain situations, but it should not be done routinely for heart disease.
Okay. And what are the most important tests to detect coronary calcium?
Great question. So that's another study that I did not mention during this talk, but as I said earlier, there is a study called cardiac CT. And remember how I said this helps us to visualize your heart arteries directly? Well, it's a similar test, except it's much faster. The test itself takes a couple of seconds. It just does a quick scan of your heart, and it tries to detect calcium in your heart artery. Now, we can then quantify how much calcium you have in your heart artery. And sometimes this is used to decide whether or not to start you on a cholesterol-lowering medication called a statin. If you don't have any coronary calcification in your heart artery, it makes it extremely unlikely you're going to have any major cardiovascular events over the next 3 to 5 years. But the point is, if you have coronary calcification, that means you have heart disease. We just don't know how severe it is.
Okay. What is cardiomyopathy?
So cardiomyopathy, again, is a vague term to describe somebody who has a disease of the heart. So you can have a cardiomyopathy in someone who have a weakening of the heart muscle. So congestive heart failure could be considered cardiomyopathy. Any diseases of the heart muscle can be called cardiomyopathy. Some patients can have a systemic disorder that can affect the heart and cause cardiomyopathy. But basically what that means is an all-encompass term that basically says you have disease of the heart muscle, cardiomyopathy. You can have cardiomyopathy due to significant coronary disease, and we call that ischemic cardiomyopathy. If your heart failure, the weakened heart muscle, is due to hypertension, we call that hypertensive cardiomyopathy. So basically it's an all-encompass term to describe a disease of the heart.
And the last question is having a sudden veil in front of your eye, like a curtain suddenly pulled down, is that a sign for a stroke?
Absolutely. if you have symptoms like that, like a curtain, like something is coming down, you should go to 911. Absolutely.
Okay.
That could mean you're having a stroke, or it could mean that there is a problem within your eye called the retina. We call it retina detachment. And if you're having those symptoms, you should go to the hospital.
Okay. I think that's it for our questions. Dr. Kim, thank you so much. That was a wonderful, wonderful presentation. What I didn't tell you were all the compliments that we were getting in the chat as well. So everybody's saying how informative and how much they appreciate it. We thank you so, so much. We thank New York Presbyterian Hospital for making all of the arrangements, and really thank you. Just a couple of announcements to everybody. Next week, we'll be having in commemoration of Crystal Knock. It'll actually end up to be a two-part program. We have several presenters that come from your peers at the Spirit program. These are children of survivors, and we truly appreciate the time and their generosity in sharing their life experiences and those of their parents with us. So it's actually going to be a two-part program. We will have our program for veterans, but it will be programmed farther out. So so just stay tuned. When you get your recording today of Dr. Kim's presentation, you will get the information to register for those sessions. And they have to be, as we do with all of our Spirit programs, because of Zoom security, each one requires a separate registration. And I know people find that annoying. I have to register for each one myself, and so do our presenters. So that's just the way it has to go. And of course, you know that you always have access to our Spirit archives, which Baruch Hashem are up to date. So anything that you want to see in the past. Oh, I do want to make mention, any of the links I sent out a week ago, 2 weeks ago, a month ago, the links that you received the same day, they do not work anymore because we have changed our Zoom account. But all of those recordings are in the archives. So all you have to do is visit the archives and you will have all those. But you can delete the ones that were in your emails because they no longer work. What we have is a new account, and today's recording will be on that new account and ultimately will be in the archives. We want to thank you, Dr. Kim, so much, and thank the hospital for making the arrangements, spending all of your time with us. I think it has been very, very helpful. And take care, everybody. Have a great day. Have a good Shabbos, and we look forward to seeing you next week.
Thank you, everyone. Stay safe.